I keep getting a lot of questions about parasite cleanse, leucovorin, what tests you need to take in order to know if you need leucovorin, and what our protocol is, what the dosage is. Parasite cleanse, what do we use? What do we use for our binder? I do have several videos on leucovorin and parasite cleanse, and you can review those for some details. I think the best thing for me to do is just tell you our journey getting to that point and why we decided to go that route. The only time Ella has ever had blood work done is when she was 3 years old. She had her tonsils and adenoids out. That's the only blood work we have on her because she is very hyperactive, does not sit still. We can't explain to her to sit still and what is happening. And I'm really nervous to have to put a needle in her to take her blood. We had blood work done on her when she was sedated, asleep, for her surgery. For years and years, I just heard people say that the best thing you can do is just try to manage her symptoms and to try to progress her with therapy. And for a while, I thought that was true until I started doing some research about what is actually happening in her brain. She got diagnosed with P10 syndrome when she was 6 years old. We finally decided to do the genetic testing, which was a saliva swab, and find out if there was an underlying reason why she had autism. She was diagnosed with autism just before her 3rd birthday. I, for a long time, was nervous to do genetic testing because I was worried that if it came back as anything but autism, her services would be cut off through ABA. Those were the only services at the time that we really had that were progressing her in our rural area. Since then, we have moved to a more suburban area that has way more resources. Eventually, I couldn't shake the feeling that something more was going on. There's some underlying reason why she had 50 to 75 words up until about 2 to 2.5, and then she regressed by the time she turned 3 to almost having no words at all. So that's why I decided to move forward with genetic testing when she was 6 years old and found out she had P10. P10 in her specifically causes autism. In a lot of kids, it causes autism on the Cowden syndrome end of the spectrum because it's a spectrum just like autism. Not everyone that has P10 has autism. I want to make that clear, but there are a lot of people where this is the case. There are some things that can happen in the brain with P10, and I always wondered if this led to Ella's autism. Could there be other things happening? I told her pediatrician, who is a very open-minded doctor, and you have to find a doctor who is very, very open-minded, and also her doctor went out on her own and started her own private practice because she prefers to heal the body instead of just treat symptoms. So she didn't like working for a medical network or group. She decided that the only way to be able to heal and treat patients the way that she wanted to was to go out and start her own private practice. So she did. She's a regular medical doctor that has other specialties in like holistic treatment. So she did other certifications in order to understand like supplements and herbs and things like that a lot better. And then she also had like a natural pharmacy attached to her doctor's office. She still does. She recommends a lot of supplements and herbs and essential oils and things like that. I ended up with this doctor because we started out with one who did work for a medical group and completely missed all of the signs of autism and wrote off all of my concerns. So we decided we need a second opinion. This person has no idea what he's doing when it comes to the needs of my child. That's when we went to her. The first time she saw her, she said, "I'm not seeing what I should be seeing." And I immediately felt validated. And ever since, this woman has been my saving grace. And everything that I have been concerned about or don't know what to do or like never even would have thought of, she knows the answer to, and she's amazing with kids with special needs. I'm not comfortable at this time sharing my doctor's info with anyone, but I'm trying to explain this to you so that you can go out and try and find a doctor that is like this, okay? You need to find someone who specializes in like alternative medicine, who maybe leans more towards the natural side of things, that leans more towards healing the body, that does not work for a medical group probably because they have rules to follow. When you work for a medical group, medical network, whatever you want to call it, they have rules to follow. There's certain things they cannot prescribe. There's certain topics they can't even go down that road. They're not allowed. And a lot of the time when it comes to healing the body, they don't know anything about healing. They only know how to treat symptoms most of the time. When you're talking about healing the body, usually if you ask them questions about, say, for example, leucovorin or parasite cleanse, they're going to give you the runaround. They're going to immediately try and shut you down like it's no big deal and it's not going to help and there's not enough research and all these things. And everybody has parasites and it's just something we live with and all of this. They're going to try and shut you down immediately. But if you find somebody that works for themselves and they actually can have their own opinion as a doctor, which they should, they're going to give you the details and they're going to probably be way more open-minded because they're allowed to be. That's part one. And I'm going to have to do a part two of our talk about leucovorin and parasite cleanse.